Hi, today's video is about a very important topic called fatty liver disease. So, many of you are aware, so whenever you go for a routine scanning, most of you have found one common finding like fatty liver. So, a few years ago, so many people are telling fatty liver is nothing to worry, it's quite a normal finding. But it's not normal. A recent study in Hyderabad, they studied some 500,000 IT employees. They found that 80% of the IT people have this fatty liver. That is quite an alarming number, 80%. So this fatty liver, if you don't treat or neglect it, it can progress. So steatohepatitis and cirrhosis and can lead to a liver failure. So early diagnosis and early intervention is always safe. Earlier, they were calling it as non-alcoholic fatty liver disease. So before that, the fatty liver and liver problems happen due to alcohol. Then they come non-alcoholic because of some other infection, other metabolic problems, infections can lead to fatty liver disease. Now, they come to the conclusion that this fatty liver is not a single entity. The fatty liver is one of the component of a spectrum of the metabolic dysfunction. Suppose somebody is obesity, somebody is diabetic, somebody is having insulin resistance. All these also have a fatty liver. So the fatty liver matlab, in common terms, suppose somebody is having a fat liver, that means you are more likely to have a metabolic dysfunction. So you have a fat liver, matlab, you are also at a high risk of developing diabetes. You are having high risk of developing cardiovascular diseases. So fatty liver itself may not cause you any symptoms, but fatty liver is a part of a metabolic dysfunction which increases the chances of developing a diabetic and other medical problems. And fatty liver sometimes, in some stages, fatty livers in advanced stages can lead to liver cancers also. So let's come. Why is fatty liver disease commonly called as now metabolic dysfunction associated fatty liver disease? What is the cause? The commonest cause is insulin resistance. Like people having overweight, people having a diabetes, people having a PCOD. Most of these people have high insulin that lead to insulin resistance that can lead to a fatty liver. So actually, in my thing, this fatty liver is a misnomer. They should have called it as a sugar liver. Because excess sugar intake converts into a fat and that deposits over the liver. That's exactly the fatty liver. So excess sugar matlab, my primary problem with insulin resistance is eating too much of refined carbohydrates, processed foods. So people keep eating cold drinks, sodas, processed foods, white rice, wheat flour, rava, maidas. These kind of refined carbohydrates and processed foods is more or less it's a sugar which converts into a fat and deposits over the liver. The primary culprit for the fatty liver is sugar intake. Sugar matlab refined carbohydrate intake that lead to insulin resistance and lead to a fatty liver. Other things, some people also have a genetic predisposition. So let's not think too much about it because something is because of genetic disposition which is not in our control. So we focus a little more on that what we can control. And third is gut microbiome. So nowadays the people are in too much of stress, people keep eating outside, multiple food varieties. The gut go for it, dysbiosis. When gut dysbiosis happens, when the gut microbiome is altered, that also one of the causative factors for the metabolic dysfunction associated with fatty liver. That's why in a previous video I told, in today's life, probiotic is one of the very important supplement to be taken on a regular basis. And how to know this fatty liver? Most of us will get when we are going to go for an ultrasound scan. We easily come to know you have a fatty liver. Suppose you want to know how bad is the fatty liver, whether it's only a mild or something else, there are some other markers are there. One is a simple FIT score. FIT score matlab, if your blood report, if you know your platelet count and your liver enzymes AST, ALT, there is a formula through which you can calculate a FIT score. And in a advanced liver diseases, you can go for a ADOPT score. And suppose you have a fatty liver grade 1 or 2, you want to know exactly how much percentage of fat is deposited to the liver, then you have to go for a little higher imaging options. One of them is MRI PDFF, MRI proton density fat fraction, which will exactly tell you above 5% what is the percentage of fat deposited over the liver. And then again, now there is fibroscan, it's quite popular nowadays in Bangalore also. So whenever you are suspecting a liver fibrosis or a stiffness, send for a fibroscan, it will count, it will quantify what is your liver elasticity, what is the quantity of fibrosis existing inside or not. So these are some of the tests we can do to know exactly what is the severity of your fatty liver. And if you know the severity, you can understand the risk of progressing into a liver failure. That's why these are the simple imaging tests, but don't do it this alone. Take help of your doctor, discuss the thing, and then go ahead. And fatty liver, why to worry more about fatty liver when this people say 80% of people have fatty liver, why should they worry? Because if you don't treat your fatty liver, your metabolic problems further worsens. Second, it can lead to a liver failure stage called cirrhosis. Sometimes it can lead to a liver cancers, and most of the people with a fatty liver dysfunction die of heart problems, cardiovascular diseases. So whenever you have a fatty liver in the earliest stage, don't neglect it. Try to rectify it. You can easily reverse in early stages with a proper lifestyle modifications. So this is a common thing. Whenever you go to a doctor, you have fatty liver. So in that 10-minute consultation, most people doesn't have time. So what they tell? You maintain a good lifestyle, good diet. It's a very broad term. What is good diet? The good diet for the fat liver is, first, cut down the sugars, cut down the refined carbohydrates, any processed foods, eat optimum protein as per your body weight, eat healthy fats. This is the good diet, a low carb diet with optimum protein and optimum fats and fiber. If you cut down the sugars, that is a single best intervention in a diet. So good lifestyle matlab, you go for regular exercise, a walking, running, gym, whatever it is, and have a good sleep, and avoid any medications which affects your liver. This is also not the important thing. So when you follow these lifestyle modifications, most of the fatty liver diseases, 80% of it can be reversible easily until this stage with the simple interventions. You need some motivation and follow it strictly. Suppose if you are not able to follow it, or in spite of it is not reversing, now you can consult your gastroenterologist, and there is one drug, it's approved by FDA, resmetirom. You can discuss about it with the gastroenterologist, whether to go for this and any other drug options. And in the final stage, somebody is really obese and have a serious fatty liver disease. So to avoid further progression, they can opt for a bariatric surgery. But I recommend in early stages, a simple interventions like cut down your sugars, optimize protein and fiber, eat healthy fats, exercise, sleep. These simple things itself can reduce your fatty liver disease associated metabolic dysfunction. That's it.